Hello and welcome to the Crisis Care Center operated by CMAR and soon to be opened. This building was actually born out of tragedy. In the summer of 2021, the Lynnwood City Council was actually set to finalize a construction contract to triple the size of our municipal jail here in Lynnwood. And about a week before that vote was set to occur, within the confines of our jail, we lost somebody. We had a very tragic and completely preventable individual in custody who took her own life. And as a result of that, there was a lot of community uproar and protest, essentially arguing against the expansion of the jail. And there was a lot of animosity that was completely understandable, particularly given what had just happened within our correctional facility here in Lynnwood. So I saw my community becoming fractured. I saw my city council here becoming fractured. And I reached out to the mayor and the then police chief. It was former Mayor Nicholas Smith, and former police chief at the time was Jim Nelson, and asked them if they'd be willing to partner on a wild idea that I had to try to broker some peace by actually cutting the project and reducing the footprint of the jail, deleting a large number of jail beds, and would they be willing to do that if I could offer them something different in its place? And my professional background is in behavioral health, and so what I was proposing to build was something that I had just seen in Arizona, which is this sort of crisis now model where we actually have a 23-hour crisis receiving facility. So this was all coming together rather last minute, and I had a meeting with the police chief till 9 o'clock on a Friday night in the summer of 2021. And to his complete credit, instead of shooing me out of his office because this was very last minute and all the plans were already cooked, he actually sat with me and drew out which part of the jail could be deleted. And then I had to go basically lobby the city council. And there was a lot of concern about delaying the project, but I was able to have individual meetings and get 4 votes, barely enough to have the council agree to delay the project to buy us time. Then I went to work to try to get funding. So I went groveling to the Snohomish County Council and was able to leverage relationships there to get our initial funding. And then I went to the legislature, and between the county and the legislature was able, in a very short time, within a year, get full funding, over $20 million for this project. And I really want to thank the Lynnwood City Council, all of our mayors, our police chiefs, current and former. It's been a tremendous collaboration, and I'm really heartened. And there are also 36 jail beds that will never exist in this community. And we have instead 36 behavioral health beds where people can receive hope and healing. And I'm really, really proud of what we've all been able to do here collectively. I'm super thrilled to be joined by my colleagues, Claudia and Sarah with CMAR, to talk a little bit more about this facility and the kind of services that will be offered here.
Yes, we plan to have 3 separate units. One, it will be ambulatory places where a client can come, have a psychiatric assessment, and be able to go back into the community. We have another unit who will be what we call the observation. The observation of patient can be up to 23 and 59 minutes. And then we will have another program where the patient can be up to 30 days. We are opening our crisis services, and Sarah can tell you a little bit more about all the services that we'll provide there.
Yeah, so at the Crisis Center, we will have SUD services, mental health therapists, mental health techs, case management, peer support, and a whole medical team 24/7.
Awesome. Can you tell, just for viewers who might not be familiar, what SUD is?
Yeah, substance use disorder professionals on site. They do assessment, screenings, and harm reduction education.
The hope for this crisis center is that a patient who come here get a screening for mental health, substance abuse, many services the client need will find a home in our primary care services. Many of the clients who are coming and returning to emergency rooms is because they don't have or are able to find the right services. We will have medication assisted treatment where the patient is able to follow up with our primary care. So we really want to become the urgent care, where a patient of behavioral health can come, stabilize, and receive all the different services they need. We won't be here today if it wasn't for the partnership for individuals like you who had incredible, made this dream come true. There's many people who have been so supportive to us to make sure that this can open, and we will do everything that is in our power to just have a good experience for the community.
Well, we're the lucky ones. We're so fortunate. I mean, CMAR is just a treasure and obviously has a presence all across, I think, Western Washington, but we're so lucky that you have such a strong presence here in Lynnwood and that you're willing to say yes to this work.
Yeah, thank you.
We are here in Lynnwood at the Center for Human Services, which is an amazing community behavioral health agency that serves much of the 32nd District from Shoreline all the way up to Lynnwood. And we are here at a new location for CHS here in the 32nd. How did we get here and why was there a relocation in the first place?
I'm Katrina. My role is that I am a department director for community-based intensive services. And so I have a team of about 50 people, and we work with some of the highest risk youth in our communities as well as families with very young children. So the reason we had to relocate is because last July we had a devastating fire and our site at the time was a complete loss.
As soon as I read in the paper last summer about the fire, and I sent Brett an email, and first of all, I'm so sorry, but we have this thing called the state capital budget, and let me know if we could help. And she was amazing and got all the paperwork in, and our capital budget writer, Rep. Callan, is particularly passionate about pediatric behavioral health, so it was an easy sell.
Yeah, we had an amazing rally of the community, and we were able to relocate into this building and build up our services and continue to serve our youth and families.
So could you tell us a little bit about the types of services that are offered here?
CHS in general offers a range of mental health services. So we have school-based therapy, we have office-based therapy. We also have substance use disorder treatment. We have things like free play groups for families with young children and free parenting classes. And the goal is really to prevent out-of-home placements or hospitalization.
Is there anything you want to share kind of about this location and why this is a particularly beneficial location, perhaps even more so than the prior location?
While the fire was devastating, we found ourselves actually in a growing hub in the Lynnwood community where we are right next door to a service center for unhoused folks and down the street from the new Lynnwood Community Center. We're very grateful for the support and have really felt the community support in being able to continue our work, and thank you.
So we are here in Lynnwood at a clinic operated by CMAR, and it's a particularly unique facility because a person is actually able to receive dental care, medical care, and behavioral health or substance use and mental health services all in the same building.
My name is Ricardo. I am the Health Center Administrator here at CMAR in Lynnwood. And we've been operating since July of 2021, and since then we've actually grown exponentially. I'd like to kind of liken it to a one-stop shop because we actually have medical, dental, and behavioral health, just like you stated. For the medical department, we have 30 exam rooms here. We have a procedure room. We do OB care here as well as specialties like sports medicine and physical therapy and cardiology. And then for our dental, we have 12 exam rooms here, 2 dentists and a pedodontist as well. And then our behavioral health specialty, we have numerous mental health therapists here, as well as a WIC program, Women and Children, and maternal support services.
Can you talk a little bit about some of the patient populations that you serve?
So we actually serve a very diverse patient population group here. We actually do have a lot of Spanish-speaking patients that come in through our doors, as well as a very big population of Afghani refugees and Ukrainian refugees. We're also the vaccine safety net for the Edmonds School District.
Where we're standing is a federally qualified health center, right. So we're an FQHC. Can you tell me a little bit about what does that mean?
Well, Federally Qualified Health Center is partially funded by the federal government, in fact, in large part to the federal government. So we are a not-for-profit, we're a non-profit organization, and so this provides a great resource for those patients to come and seek the care that they really, really desperately need, and so we're proud to continue serving in that capacity. You should definitely come and pay us a visit anytime you get a chance because we're really looking forward to meet the rest of the community. We keep growing bigger and bigger and just look forward to seeing the rest of you.
Hello, we are here in Lynnwood at what will be Housing Hope Alliance Place.
Hi, I'm Rachel Downs. I'm the Chief Strategic Officer at Housing Hope, and we are so excited to be here at Alliance Place, which was funded for pre-development in the state capital budget this year. So thank you to Lauren Davis and your colleagues. This is going to be over 160 units of deeply affordable housing for our neighbors in need right here in Linwood. This project is so important because it not only brings affordable housing right next to the Linwood Light Rail Station, we also have other community serving uses in this project. We're going to have a child care center, we're going to have job training, and we're going to have behavioral health services. And we can't thank the legislature enough for supporting this project in the capital budget.
Well, we're grateful for your vision. I mean, yeah, the light rail is, of course, here right behind us. And so when we think about transit-oriented development and, gas prices are through the roof right now, but a lot of people may not even own a vehicle to begin with or even have a driver's license, but the ability to have access, all the way to Federal Way, the airport, downtown Seattle, out their front door, basically. I'd love to know, because my background's in behavioral health, a little bit more about the partnership with Center for Human Services and the services that will be offered right on site.
Yeah, for sure. Center for Human Services is partnering with us. They're going to basically create a large office here where they will have their staff based. They'll also have space for individual therapy, one-on-one therapy. And it's going to be so amazing because, as you know, Center for Human Services, they serve the same target population that Housing Hope does. They really focus on families who have experienced trauma, who are living in poverty and don't have as many resources as other families do. So this is really going to be a one-stop shop where families can get all the care they need. And it's not just for residents on site. We're here right next to the light rail station. We're hoping that people will come in from all around South County, even North King County, to get the care that they need right here at Alliance Place.
But who will live here?
Oh yeah, it will be mostly families with children. That's what Housing Hope, that's our target population. So we're gonna have over 160 units here, and about 75% of that will be 2 and 3 bedroom units, really designed for families. But we'll also have some 1 bedroom units for singles.
Which is such a tremendous need in our community right now. So thank you for your vision and leadership and partnership. I can't wait to have this be more than a field.
Yes, thank you.
So here we are in Shoreline at a really special and unique location. We're here at the forthcoming Edwin Pratt Memorial Park. Edwin Pratt was a civil rights hero, very involved with the NAACP. He and his family were the first African-American family to live in Shoreline. So we have done a lot in the city of Shoreline to try to highlight his legacy. We have an early learning center, the Edwin Pratt Early Learning Center, that we're very proud of here in town. We have an annual recognition honoring of his legacy. And then the most recent addition is this park, which I was really delighted to advocate for funding for in the state capital budget. So very glad to be joined by Jacob from Shoreline Parks.
Yeah, absolutely. So right now we're in design development. That is funded by our Department of Commerce grant that you're so involved in. And right now we're just wrapping up public engagement. So we asked Shoreline residents to give us input on what they want to see out here. We also have a focus group that's primarily composed of people of color. There's friends and family of Edwin Pratt that are involved as well. We're working very closely with them on the designs. Ultimately, when we have a conceptual drawing, we'll go to permits, and then when we can find funding, then we'll build the park.
Yeah, no, that's super exciting, but I also appreciate the wherewithal the city had to preserve green spaces and open spaces in the first place.
This park was purchased with a Conservation Futures grant in 2020, and then it was named after Edwin Pratt in 2021. This is one of Shoreline's longest land bank properties that's been undeveloped, and so we're so thankful now to be able to finally develop it. And we're limited in what we can actually build here in a sense. Sure. So it's all passive recreation. We're limited on the amount of impervious surfaces as well. So sure. A lot of nature, just reflection, quiet space. It's going to be really nice once we finish it.
Seems really appropriate too,
yes,
and a way to honor his memory. So
yes.
Awesome. We are here in Linwood at the Washington West African Center, one of my favorite places in Linwood. It's particularly meaningful to me because I actually used to live in West Africa. I spent 2.5 years in Ghana in my early 20s. And I am here with Pa Usman, who's going to talk to us about one of the capital budget projects that I was able to help fund this last legislative session.
Washington State is home to about 20,000 West Africans, mostly living in Snohomish, King, Pierce, and Clark counties. And the Futuristic West African Village project is our vision and mission of a one-stop hub that would provide cultural cultural relevant wraparound services for the West African community here. We'll have about 15 housing units, a food processing and distribution center, our state-of-the-art event center, daycare center, and an early learning facility, and of course, our office space.
I think you're even going to have washing stations, right, for ablution prior to prayer. Is that correct?
Yes, that is all part of the community center. Of course, that's the community center part of it. Yes, we do. If you see right behind us over there, you can see these banners is covering our masjid, our prayer areas. So when we have the futuristic village, yes, part of the project includes to have a station where we would be able to do our different prayers and all of it, whether it's Muslims, Christians, and accommodate all religious beliefs of people from our community. In 2025, 2026, we still continue to go through a lot of discriminations, and this is why it is important for us to have the futuristic West African village that would serve as a culturally appropriate setting, a one-stop hub, and a culturally appropriate and safe space for our community.
Thank you, Pa, for your incredible leadership and your vision. I look forward to continuing the work with you.
Thank you very much,
Right.
Davis.
Thank you.
Thank you.
We are here in the city of Shoreline, and I'm super excited to be joined by Mayor Betsy Robertson, who's going to talk to us about the North City Commons project.
We are just a stone's throw from the North Shoreline Light Rail Station in a place that is going to soon be called the North City Commons, which is going to include an arts and eats market. This is a well-known piece of property to pretty much anyone who lives in Shoreline. We all know about that old lawnmower shop. Well, there was a vision by the neighborhood to make it something that could really bring community together.
What can people expect once it's all done and the vision has fully come to life?
So the vision really is a joint effort, right? The city has put in $300,000. Thank you to our delegation for another $275,000 that we're going to be able to invest in cleaning up this property, shoring up the building behind us. We've brought in a local consultant. They're already running kind of an arts facility here in Shoreline called Salvation.
I know there's a bunch of neighbors excited, but what kind of buzz or feedback have you heard from Shoreline residents about the project?
So just earlier this spring, I got to be part of a group of 100 plus individuals, and we spent a day cleaning this property. There was a lot of work done. What it was 100 people excited about being a part of something that is going to be here for generations to come.
I really applaud and appreciate your leadership and vision, and super excited to play a small piece in helping it come to life.
Thank you so much.
So we are here in the city of Kenmore, which is actually located just outside the 32nd district, but there's a whole backstory and a reason for my involvement in this project. I've done a whole lot of work related to domestic violence. I myself am a survivor of domestic violence and twice had to flee my home because of the danger, and I understand what it's like, particularly for people who might have nowhere to flee. And I've been really interested in trying to find resources and options and opportunities for particularly women and children who are fleeing very, very dangerous situations and have nowhere to go. And unfortunately for domestic violence victims in the 32nd district in particular, there really is often absolutely nowhere to go because every shelter in King County is full. Snohomish County has one shelter and it's often full every night. So last summer, the summer of 2025, I was meeting with a very engaged constituent of mine, and she asked me to come over to her house. She's an older lady and I think doesn't drive anymore. So I am in her living room, and then all of a sudden, unbeknownst to me, in walks Dr. Joe Pizzorno, who turns out is the president of Bastyr University, originally the founding president, and then had returned to run the university. So we were having this conversation primarily about naturopathic medicine and healthcare services, but he sort of made an offhand comment about having these dormitories on campus that were largely empty. And my little ears perked up and started to think about potential uses for said empty dormitories. And so I would love to hear what your vision is and what your thoughts are about this project.
Well, we have women who've suffered abuse and have children and nowhere to go. Using one of our dorms for that, a healing community. We have our organic cafeteria. We have walks in the forest here, in this beautiful forest. We have the teaching clinic right next door for the children who might need health care. it seems like a wonderful opportunity to advance our mission of health and healing.
Well, we're sure excited. And yeah, to your point about the ability to potentially have victims and survivors or their children actually receive care from your students and faculty and access to naturopathic medicine that they might not otherwise have.
We exist to be a resource for the community. So that's why we're excited not only to bring our teaching clinic here, but also to bring in various groups like yours to create an environment where people can come from literally all over the world and say, here's a place where I can get healing and get better and no longer be so dependent upon drugs and all the other problems people get into.
Well, I just can't thank you enough, Dr. Joe, for your partnership and willing to embark on this. And again, we'll see as it takes shape, but I'm really appreciative of the leadership of Bastyr and willingness to start from a place of yes and sort of link arms on this. And we'll see what we build, but I'm confident it will be beautiful wherever we land.
And thank you for your leadership. I'm really excited to see where this goes. I think there are things we can do here that could be modeled elsewhere that could help really make a big difference in our community.
Awesome. Well, thank you again very much. Appreciate it.